that also help?
Yes, in pain reprocessing therapy, we teach a skill called somatic tracking, somatic
Yeah.
tracking.
Could you explain that? That's a great one.
Yeah, so it's a tool, it's a type of meditation in many ways, but what it is teaching our brain to pay attention. I'm looking at my knee here, pretending that I have chronic knee symptoms. And
Hmm.
we go into a somatic tracking exercise, telling our brain that we're going to observe what is going on with the knee and working very hard not to respond to it, regardless of what happens. And so there's three different components to somatic tracking. And one of them is mindfulness. One of them is positive affect induction, because what happens with those of us with chronic pain and when we're dealing with chronic symptoms, we tend to be very serious. And we
Yeah.
tend to be I mean, honestly, we get depressed, of course, because we're having chronic symptoms.
AKA miserable.
Yes, exactly. We're miserable.
Yeah.
Um, and what happens is that is, again, that emotional response to a symptom increases the likelihood that it will stick around. Whereas if we have the emotional response to be neutral or
Hmm.
like kind of be silly or goofy in the face of these symptoms, which I know sounds impossible to people sometimes, but
Yeah.
that's why we therapists can lead you through this. And I will toot my own horn though that the being the goofy part of this is easy for me. I'm proud of that. In somatic tracking, you're doing this mindfulness exercise. You're doing a positive affect, you're having positive affect induction so that you can feel a little bit lighter around the symptom. And then there's another element called safety reappraisal, where again, looking at my knee, where I would want to send myself messages of safety that my knee is okay right now.
Right.
No, I'm not moving my knee. It is safe. I don't need to be afraid of my knee. It is safe right now. The stories that I have in the back of my mind about why my knee is hurting right now, all I need to know is that it's safe. And those three kind of components, it's like riding a bike. They start off, you fall off the bike pretty quickly,
Yeah.
but then you do that more and more and it gets easier. And it's really effective and powerful for people. It's
And
what we
so
do in the research too.
would
So,
people be doing these practices either you've talked about calming, like meditation, you've just
huh?
talked about somatic tracking,
Yeah,
you've talked about awareness, you've talked about noticing thoughts and being
yeah,
willing to shift them. Are
yeah.
those things people would do like multiple times a day, kind of whenever it arises, they would go, oh, I see what's happening here and I'm going to shift it.
As many times as we notice an unhealthy behavior,
Yeah.
we want to start to shift it. So the
Okay.
answer is yes. If